The new administration began its term with a mandate to cut federal red tape and move the U.S. healthcare bureaucracy into the digital age. The centerpiece of this effort was a streamlined public directory, built to help seniors easily match with doctors in their insurance networks. But weeks after the launch, a critical security failure was uncovered. The portal was broadcasting the private Social Security numbers of U.S. healthcare providers to the open internet. The data remained publicly accessible as an unforced internal failure until reporters at the Washington Post discovered and flagged the exposure. The government's flagship attempt to modernize its systems had immediately compromised the identities of the medical professionals required to keep those systems running. This collapse occurred because of a breakdown in data governance, the digital safety net that prevents human errors from becoming public disasters. To participate in Medicare, providers must navigate massive registration forms containing dozens of required fields. It is a process where a single misplaced entry can have significant consequences. A provider accidentally entered their Social Security number into an unencrypted notes box rather than the secure tax ID field. Typically, data validation blocks sensitive 9-digit strings. Here, the form accepted it, allowing the number to remain in plain text. Because the software was programmed to trust text in that notes box, the unencrypted data bypassed security protocols. The automated directory software then pulled that plain text data and published it directly onto the consumer-facing Medicare portal. When federal software is deployed without basic data validation, a simple human typo transforms into a public vulnerability. While the software failed, the decision to release it came from the leadership at the Centers for Medicare and Medicaid Services, or CMS. CMS was operating under a new mandate from the Department of Government Efficiency, which demanded aggressive staffing cuts across federal agencies. This resulted in the abrupt termination of hundreds of CMS employees just months before the portal was scheduled to go live. This chart shows the rapid reduction in CMS staff levels, directly impacting the agency's ability to oversee technical projects. Among those fired were the quality assurance and software testing teams, the specific groups responsible for catching data errors. Removing the teams tasked with identifying system flaws effectively dismantled the safety filters designed to protect sensitive information, allowing preventable errors to reach the public. The portal was taken offline after the media intervened, but the agency did not issue a formal apology to the providers whose personal data was exposed. Instead, the official statement from CMS attributed the breach to incorrect entries by the providers themselves, rather than a lack of software validation. This left many physicians confused and concerned, as they had no expectation that Medicare would publish their personal Social Security numbers. The burden of the breach now falls on the victims, who must now freeze their credit, monitor for suspicious activity, and file police reports to protect themselves from identity theft. These failures erode the relationship between healthcare professionals and the federal agencies they rely on for accurate information and secure data handling. As the drive for deregulation continues, this breach demonstrates that the price of such rapid downsizing is a measurable loss of security and privacy for the public.